I want to welcome everybody here this morning for an engaging discussion by the experts sitting here before you, and for the release of the global report on preterm birth commissioned by the Bill Melinda Gates Foundation. Nearly 200 participants reviewed an early draft of the report and made recommendations that resulted in a 2015 Global Action Agenda at a conference co-convened by GAPS, the Gates Foundation, the March of Dimes, PATH, Save the Children, and WHO. As CEO of Seattle Children's Hospital, it's my honor to be here. The Global Alliance for Prevention of Prematurity and Stillbirth, or GAPS, is an initiative of Seattle Children's with the lofty goal of eliminating preterm birth and stillbirth around the world. Many of our patients suffer serious health problems as a result of preterm birth, driving us to find ways to reduce the incidence of and improve survival for all babies born too soon. Unfortunately, despite many medical advances that have improved maternal and child health, prematurity and stillbirth remain growing crises that urgently require local and global attention. We live in a modern world where the spirit of discovery and innovation have led to improved health, better outcomes, and medical cures for so many. Yet 13 million infants are born prematurely each year, and more than 1 million of those infants die. Coupled with the nearly 3 million stillbirths each year, these two conditions are the #1 causes of infant mortality around the world and in this country. Tragically, the causes of preterm birth and stillbirth remain largely unknown. What we do know is that we urgently need better data and tools and more champions and resources to address this truly global challenge. The preterm birth rate has risen in most industrialized countries, with the USA rate increasing nearly 30% in the last 30 years. In fact, the US leads the world in preterm births. This is despite advancing knowledge of risk factors and mechanisms related to preterm labor and the introduction of many public health and medical interventions designed to reduce preterm birth. To increase awareness and accelerate innovative research and interventions, we must encourage initiatives that promote interdisciplinary research and an international commitment. This mission means a lot to me personally in a couple of different ways. Before becoming a hospital CEO, I was a neonatologist and witnessed firsthand the carnage associated with preterm birth. As a result, I spent much of my time in the laboratory trying to find ways to save the lives of preterm babies with lung disease. That research continues today. Each week I spend time at our research institute trying to develop a low-cost way of helping infants around the world deal with the respiratory problems that are attendant to preterm birth. Why the continued interest in research? Because I believe that through medical research and collaboration in the form of GAPS, we can see the end of this global crisis of preterm birth and stillbirth. That's the scientist in me, that's the optimist in me, but I know I'm not alone. I know that I share that hope with the rest of you. Preterm birth also became a very personal issue for me in 1989, when my son William was born at 32 weeks gestation, weighing 4 pounds 10 ounces. At his birth, I could not help but remember that Patrick Kennedy was born at exactly the same gestation and birth weight. Thankfully, my son's outcome was superb thanks to treatments like antenatal steroids and modern neonatal intensive care. Yet it was a very trying time for his parents, a neonatologist and a neonatal intensive care nurse. Our goal is that no parent should ever go through the trauma of a preterm birth or a stillbirth. And I know that you all agree with that.